I'm back with Dr. Michael Fox, who's a medical doctor and a fertility specialist. In an earlier video, we were talking about women having trouble getting pregnant because of metabolic problems, obesity. But there's another common reason why women don't get pregnant. Would you elaborate on that?
Sure. Well, when we look at ovulation disorders, the more common presentation is the metabolic so-called polycystic ovary. But there's actually another growing problem in our world that is sort of the opposite end of the spectrum, which I tend to call the stress-induced ovulation disorder. And actually, now that we're really focused on that, we see some evidence of stress in the polycystic ovary patients as well. So a lot of people have a mixed picture. But when we use the word stress, we're not talking about, had a bad day at work or I'm studying for final exams or something like that. We're talking about physiologic stress where your brain thinks you're undergoing a life-threatening emergency. And in our world today, that's typically over-exercise or what I would term starvation stress. So if women are cutting their calories, or we even see it in the bariatric patients that have had bariatric surgery and they're losing 100 pounds in a year, the body senses that as a life-threatening stress, and since nature would not want a stressed female to become pregnant, which would be another stress, the first thing it does is turn off reproduction.
Okay, so you're saying that too much exercise, too much stress, and not eating enough could be a problem for fertility?
Right.
And that's
it's aerobic exercise.
Aerobic exercise, like treadmills and stuff like that?
Treadmills, running, stationary bike, ellipticals.
And this is a big problem in the U.S. today?
It is, and I'm in Florida, so it's always good weather, and people are out cycling and running and marathons and half marathons.
But you're basically saying that people trying to lead healthy lives are putting their fertility at risk?
I would definitely say that.
Eating less and running more?
Right.
Could be bad for your chances of getting a kid?
That's exactly right. And what we're seeing now, the reason it's the problem is blossoming so much is because about 20 years or so ago, the push for aerobic exercise really gained ground, and a lot of our kids now are starting in an aerobic world at age 5, 6, 7, and all the way through high school. The girls are in these highly competitive sports, and the hypothalamic reaction to that is very powerful. And what's very disturbing to patients is, even if, say, in college they quit their exercise and they gain some weight, they actually don't really recover in a hypothalamic way to complete normality. That is. Okay,
so but exercise is supposed to be good for you, right? You must be able to do some exercise.
You can, and we believe that resistance training or strength, muscle strengthening exercises are very positive, but it's the heart rate at 150 for 15, 20, 30 minutes that if you stand back and think about it, that's probably not so natural for humans or the caveman. They were really not training for high-level aerobic activity.
And 15 minutes, that's not all that a lot of people are doing that, right? I mean, some people are doing like an hour several times a week.
Oh, yes. And in fact, and people are very addicted to this sort of exercise. And so I have a lot of patients come in and say, well, I heard that maybe high-level exercise was not so good, so I cut back. I'm not exercising much. But when we ask what they're doing, they're running 5 miles 4 times a week.
So that's still a lot.
What
kind of
much.
recommendation do you give to patients that has this sort of problem getting pregnant and they exercise a lot? How much should they scale it down to? Should they stop completely?
Well, it's kind of like the nutrition. Yeah, we think once somebody has a hypothalamic sensitization, which I sort of define as at least a year somewhere in their life where they did high-level aerobic training. Once they're sensitized, then very small stressors seem to really impact the system. So all these patients have already been sensitized. So unfortunately, we have to say to them, as much as you can, 0 is the best number. But then we try to divert them into walking, leisurely riding their bike, doing resistance training, and maybe getting into other activities that could take the place of the exercise.
And what about the calorie restriction, eating less? That's a stress too?
Yeah, we think that's a huge stress. I mean, if you think about the body system and the sensing system for the body, oxygen levels, blood pressure levels, and sort of fuel or blood sugar would be the biggest areas that your system would want to protect. And starvation would be sort of the worst outcome. And so if starvation has been sensed, that's going to send your body into all kinds of corrective mechanisms. And again, nature doesn't want a starving female to become pregnant. That's not going to promote the preservation of the species. So I think that's one of the most powerful inhibitors of fertility and health in general.
So for females wanting to get pregnant, how much should they eat a day? How many calories?
Well, they should have enough. I mean, whatever that number is, I don't think anybody knows the right number, but we tell patients not to worry about calories. If you're not eating carbohydrates, the calories don't really matter, and your system will tell you when to stop.
So you're going to eat the correct amount just by listening to your hunger feelings?
True, but this group of patients that we're talking about typically is thin, in many situations almost underweight a little bit. They're at really high risk for hypoglycemia. When we talk about the symptoms of nausea, shaky, moodiness, headaches, they all nod their heads like, it happens to them a lot. So the other thing, it's not about calories by itself, but it's also about frequency of eating, and so we tell patients they should go no longer than 3 hours without calorie intake.
So you're saying to these thin and healthy and exercising women that they should basically start eating more and exercising less?
Correct.
And what kind of reaction do you get from them? Because that's like the opposite, right, of what everybody else is saying.
That's correct, and that it's a very difficult thing to sell to people, and we get tears, we get anger, we get all kinds of reactions.
Yeah. So it's not what they expect to hear.
It's not, and some patients are so addicted to the running and the what we would think is the endorphin response that they can't deal with it, and they won't do it. They won't stop.
But if these women can cut back on their exercise and eat more and more often so that they're not hungry, not starving, what kind of reaction do you see when it comes to pregnancy rates? And what kind of an effect do you see? Do they gain a lot of weight?
Oh, they don't gain a lot of weight. In fact, it's odd, but some of the patients that are a little bit underweight actually lose a few more pounds. But their body composition changes, and they notice that the central fat goes away, and they're probably gaining some lean muscle there. But the pregnancy rates are better. The patients that are able to really embody this whole approach, when they come back a month or 6 weeks later, they actually will report that they feel so much better. They have more energy, they're so much less anxious. And then the other thing that the body does in that whole physiology is it slows the thyroid down, and therefore the metabolic rate. And these women are always cold, their hands are cold. And what they report when they get more calories is they report that they've warmed up and they're no longer freezing all the time.
All right, so just to clear things up for people watching, what kind of symptoms would you get if you're over exercising, if you're not eating enough? I mean, you might not get pregnant, but what other kind of symptoms would you expect? You mentioned cold hands and feet.
Yeah, you're talking about the negative symptoms?
Yeah, what kind of, how would you know that you're in the risk zone of kind of having this problem?
Anxiety, headaches, some patients actually get nausea, they have bouts of hypoglycemia where they're shaky and extremely tired, or they're craving carbohydrates, chronic fatigue, if they're not running they feel very fatigued, sleep disturbance. I mean, you can name pretty much anything.
Sound like common problems.
Right. And a lot of these patients are already on anxiety medicines and depression medicines, and I think they've sought out the healthcare system with those symptoms, and then they're provided those medicines, when really what they need is just to sort of change their approach to their metabolism.
So exercise less, eat more, but cut out all the bad carbohydrates ideally.
Right.
And what kind of results do you see when it comes to these mental problems like anxiety and depressive disorders you mentioned? What happens?
They get a lot better. Typically what we'll do is if we see the patient really take on the approach and we know they're doing well and their metabolic rate comes up, we'll start to talk about weaning them off of those drugs, and typically they don't feel any different once they wean off, so they realize they didn't really need that medicine at that point.
So anyway, to sum things up, to sum things up, your recipe for improved fertility in women is basically don't exercise too much, but do eat enough,
right,
and try to cut down on the carbohydrates, right?
Right.
And what kind of food would you say is ideal for, nutrition when you want to get pregnant and nourish a child growing?
So we usually talk to patients about just in general thinking about fat as their number one calorie source, then protein, then our term would be non-starchy vegetables. So we try to push various examples in those food groups, and then trying to stay away from carbohydrates altogether.
So soda and cakes and candy, that's not good for pregnancy?
Right, not good at all.
Okay, so then everybody knows how to do it. And if they want to seek you out, you're working in Jacksonville in Florida, and you have a website. People can go there from all over if they want help
Sure.
doing this. What's your website?
It's www.jcrm.org.
jcrm.org. That's Jacksonville. Was it?
Center for Reproductive Medicine.
Yes. So thank you very much, Dr. Michael Fox, for this second interview. And for people wanting to see the first one, that's about more metabolic problems, obesity and fertility, they can click on the link that I'm providing on screen right now. Thanks again.
Thank you, Andreas.